Just get you to line up against the wall here, kind of spaced out.
At a Halifax hotel, a new send-off to sea.
All right, you're all ready to go?
A COVID test before these men and the rest of the 35-person clam harvesting crew set off together. It's a little discomfort now, but they'll get a result back within the day, and the peace of mind that comes with it.
Making sure we take that extra level of precaution was for us to sleep at night, but also for our employees and their families, knowing that we're doing everything we possibly can to make sure that they're safe and the vessel's safe and they're coming home, in a safe manner.
Tony Jabour is Vice President of Fleet Operations for Clearwater. Last fall, the seafood company invested in mobile PCR tests, like the ones used in public health labs to detect genetic material of the COVID-19 virus. Only these deliver results in a couple of hours. It's an added measure, Clearwater says, to stay safe and stay afloat.
When you go on board of a vessel, we do social distancing, staggered meals, that type of stuff, but you cannot 100% social distance. And then you're at sea for 35 days. So it was really important that to add that to our screening process and make sure we don't have an asymptomatic case that gets on one of the vessels and we have a major outbreak. It would be catastrophic.
From fisheries to pharmacies, COVID tests are being used in dozens of sites across the country and being tested to for wider use.
Are you experiencing any of the following symptoms? Fever?
In Mississauga, this Shoppers Drug Mart is part of a new pilot project. Its parent company, Loblaw, is offering rapid tests to employees in nearly 20 of its pharmacies and retail locations in Ontario and Alberta. The test used here is designed to pick up antigens in someone infected with COVID. With a shorter swab, antigen tests are less invasive and deliver results in a matter of minutes. They're not as sensitive as the gold standard PCR test, but they're easy and quick. And pharmacist Mohamed El Sabakhawi says that makes them ideal for screening purposes.
Because of the nature of COVID, there are asymptomatic people going around. They could be spreading the virus not knowing. The value that this can bring is we can catch it early and stop the spread of the virus.
Danica Gettin-Kerr has been working throughout the pandemic and has lived with the stress of potentially bringing COVID home.
I have my 2-year-old and I have my mom who's high risk. So for me, it's really awesome knowing that I'm not putting them at risk.
She and other employees get tested twice a week.
Knowing that we are in an environment providing care for other people that are sick, and we need to be careful. We need to make sure that we are taking higher precautions than the normal person would.
Ottawa has delivered nearly 17 million rapid antigen tests to provinces over the past few months, but only a fraction have been used so far. Part of the reluctance is rapid antigen tests aren't as reliable as the PCR tests used in hospitals and test centers. But there is growing interest to find out how useful rapid tests can be. Pensionnat de Saint-Nom-de-Marie is one of 2 schools in Montreal where students are randomly tested every day and will be until the end of the school year. The goal is to identify and contain any asymptomatic cases as quickly as possible. The study was proposed by a doctor who is also a school parent.
We are all wanting our children to go to school and to be in school.
Dr. Caroline Quash is a pediatric infectious disease specialist at St. Justin Hospital. Quash wants to determine how useful rapid tests can be when used regularly in a controlled environment. The plan is to verify any positive samples with a PCR test and also sequence those samples to find out where the infection came from.
In a classroom, when you have a case and you screen the students around them, you might be able to find, secondary transmission right away. And so you can act more quickly on that child's family, their siblings, if they're in school already.
The growing interest in rapid tests, the reality of the resources needed to use them more widely, is prompting real-time solutions.
It was really essential for us to be able to get this up and running and support the testing. Obviously doing a great job with your technique.
Curtis Abb is the acting chair of the Life Sciences Department at Red River College in Winnipeg. The college set up this condensed course in a matter of weeks to support the province's plan to offer rapid testing to teachers. These students are learning how to transfer samples for analysis. Their skills will be in demand, says Abb, and will help the province use every tool available to control the spread of COVID.
We talked to a lot of people that have had to go for COVID-19 testing and the wait times and some of the anxiety associated with that. So I think, the opportunity to have rapid tests available, to get those results faster, to give more clarity to patients in a quicker amount of time is a great thing to have and great to be a part of.
But while the value of rapid testing is promising, it is still emerging and the data is limited.
I think that the evidence base is firming up and kind of supports the initial idea that this can be useful if it's positive, but that you can't rely on it if it's negative. And,
Dr. Lenora Saxinger is an infectious disease expert at the University of Alberta. She says the concern is people, already weary of the pandemic, may drop their guard. Because while a positive result can be a warning sign, a negative one may result in a false sense of reassurance.
So if you get a test and it's negative, it does not mean that you do not carry the virus, and it does not mean that you might not start carrying the virus over a very short time period after the test. So you can't use it to rule out infection. Whereas I know just anecdotally that people still tend to like to rely on a test and get a test to make sure they're not infectious so that they can go do something like visit grandma or whatever. And that's exactly what we don't want to happen.
At Shoppers Drug Mart, the messaging is rapid testing is just an added layer of precaution, especially for essential workers. And Loblaw is hoping what it learns here could help it scale up.
And so we thought that this could be a possible solution to small, medium businesses to send their employees to one of our stores.
Ashish Desai is the Executive Vice President of Pharmacy and Healthcare at Shoppers Drug Mart. He says Loblaw could offer rapid testing to other companies too.
So the process could be that they've signed up to participate in this program. Their employees could go into any one of our stores, whether it's a Shoppers Drug Mart or a Loblaw pharmacy. So if I'm grocery shopping Sunday afternoon, maybe there's an opportunity for me to book a screen at that point in time.
Back in Nova Scotia, most of the crew of the Arctic Endurance is on board, ready to set off from Mulgrave for more than a month at sea. Everyone's test came back negative, and while the results here took hours rather than minutes to get back, they are more accurate. So while the weather can turn, at least on the COVID front, the coast is pretty clear. Joanna Rumiliotis, CBC News, Toronto.